7:27, we're into award season now, and the red carpets are becoming just as important as the award shows themselves, it seems. Grammys were this past weekend. Up next, the Oscars.
And in 2 weeks, right?
2 weeks, and according to Dr. Frank Lista from the Plastic Surgery Clinic, celebrities are already getting ready for the red carpet.
Yes, they are. But apparently, though, in some of these procedures, Dr. Lista, you got to do them a couple of weeks ahead for it to get the right effect. Am I correct on that?
Yeah. The biggest mistake anyone can make is to do it like the day before, or the weekend before. No, the bruises are hard to cover. But the truth is that celebrities they just never stop. Like it's a continual process. It's like having your hair done. You never want the wrinkles to come back.
Wow.
So they've been doing it all year.
Dr. Frank and I were just talking about there's a new effect in plastic surgery called
the Kardashian effect.
And so what is we know that they've had a lot of plastic surgery, very forward about it.
They're also open about it.
Yeah.
And it's not just surgery, it's Kylie Jenner and her lips, right?
Yes.
So it's the Kardashian effect is like it's totally open now. And young people are doing it. I mean, how old is Kylie, right? And so we're having 20-year-olds not having surgery, having injections, Botox, Juvederm. So it's made plastic surgery way more open. People are talking about it.
So what kind of skincare treatments do the stars do because you have to have good skin for the best results?
Well, we say plastic surgery is like a foundation, right? It's a pyramid, and at the very bottom of the pyramid, the base is skincare. So you need to be using really good skincare every single day.
Yeah.
And then it's the other stuff that you do afterwards, the injections, the Botox, the Juvederm, which is really super easy. It's like, it's maintenance.
Botox is, let's explain what that does.
So Botox stops you from getting wrinkles, and it's best in the upper forehead and around the eyes. So, when you get those 11s when you're mad, or those lines on your forehead, Botox prevents those. But not only does it make those go away, but it prevents them from forming. Because if you're always folding in the same spot over and over and over again, you're going to get a permanent wrinkle.
How long does that last?
You need to do it about 2 or 3 times a year.
Okay, Juvederm, what does that do?
So Juvederm is a filler, so people get those confused. So Juvederm is a hyaluronic acid filler, and it's to plump up areas where you're deficient. So your cheeks, your smile lines, and the big one now is the lips.
You have to be careful with the lips.
You got to be careful.
What was the third thing that you're talking to us about? The Juvederm, you got the Botox, and what else do they do?
Well, then skin treatments, right?
Yeah.
So peels, and now the non-invasive lasers. So laser treatments that don't require any time off, and people say, "Wow, you look amazing."
Yeah. So how long is that? Yeah, I mean, is there a booklet that you have to do 2 or 3 sessions before you get the best results? Is that kind of a thing?
Well, yeah. I mean, skincare is like, we tell people skincare is like going to your personal trainer. You need to do it all the time.
Yeah.
You need to start early, start young, and then you add the other things, and with the help of a professional, it keeps you keeps you current. Yeah,
we like
yeah,
keeping
baby, current.
Let me just ask you this. These kinds of things, I'm just thinking about, a lot of people who can't afford some of this, because these things aren't inexpensive.
Yeah.
So what do you recommend for the average person to do who can't afford some of the more expensive procedures?
The very first thing is skincare. So that's like the number one thing. You need to find a good skincare line. I mean, we're really super proud of Miracle 10, which is our own skincare line. But, a good skincare line, you need to do that every day. And that's not any more expensive than soap and water.
And if you start when you're young.
And if you start when you're young, it's going to count. It's going to last forever. And then, Botox is not that expensive. Like if you're a young person with the 11s in your forehead, I mean, Botox might cost $100 or $200 to do that, and you do that 2 or 3 times a year. I mean, you probably spend more on your hair than you do on Botox.
Okay, what is Thermi Smooth?
So Thermi is...
Thermi Smooth.
Yeah, Thermi. Thermi is the latest and greatest skin tightening treatment we have now. It's radio frequency, and there's different ways of administering it, but the most effective way is in loose areas, especially the neck or loose areas of the tummy, and we place a really, really tiny needle. We put some freezing in, place a tiny needle under the skin, and it applies radio frequency to the skin from underneath, and it tightens the skin. So if you have looseness of your neck or looseness around your belly button, and you don't really need surgery, you don't really want surgery, this is super effective.
Okay, one session with you?
One treatment.
Okay, and how long is the treatment?
About half an hour.
Downtime?
you might have a little bruise. You go back to work the next day with makeup.
Okay, CoolSculpting. What's that?
Oh my goodness, CoolSculpting is like off the hook. I never imagined CoolSculpting to be as popular as it is now. You got a little roll of fat that you can pinch somewhere. Your weight's okay, close. Got a little roll of fat somewhere on your body you don't like. You come in, we apply the applicator. It puts cold on the area. It turns out that fat cells don't like cold. And it freezes the fat cells, and they go away without surgery. I didn't believe it when I first heard about it, and I had it done myself. It's amazing.
How many sessions?
Well, every time you do it, you lose 25%.
Okay.
So if you imagine your roll, you do it once, that's 25% less. Most people do it, 2 or 3 times. And it's really popular with men because men are chicken, right? They don't want to have surgery, don't want to have liposuction. I have to tell you, it's remarkable.
PicoWay.
So PicoWay.
Oh, that's a tattoo removal.
Well, tattooed brow spots.
It sounds so nice, but it might be painful.
We put freezing stuff on. So
Don't say
that's not
Pico to me.
But it's funny when you look at all the stars who are changing their tattoos.
Oh my gosh, I see some of them with so many of them, and I'm thinking one day you won't want those there.
Well, the best way to avoid tattoo removal is to not to have the tattoo in the first place.
Of your old boyfriend, your old girlfriend, right? That's right.
Don't go saying that. That's bad for business.
So basically, that's a couple of sessions, right?
Yeah, so it's interesting because sometimes people don't want the tattoo removed; they want it modified.
Yeah.
So we'll take off, like what's his name took off
Johnny Depp.
Winona Forever.
Wino
Forever.
Wino Forever.
We just took a few letters off.
Yeah, that's right. So there's lots to do. So we know that we see those stars, both men and women, on the red carpet. They have done many, many visits.
They're
to the
all doing
doctor.
it, and you know what? Probably people you know and love are doing it too.
That's okay.
But you don't know that, right?
That's
it
the
can
key.
be done.
Well, I know that, but other people.
know what,
But it can be done in such a way that other people don't really
and
know.
that's the
right?
thing. I mean, everyone sees bad lips or bad cheeks, but most people have great lips and great cheeks. You don't even know.
Yeah. All right.
Thank you, Dr. Frank.
Hey, great. Thanks for asking me.
Dr. Frank Lista of the Plastic Surgery Clinic.
I think you and I should go naked and stand out in the corner so we can kill our fat cells.
Didn't we do that once?
CoolSculpting.
Didn't we do that once on a park bench?
Yes, we did.
Yeah.